You know, if I were a coach building a team, I couldn't ask for a better lineup. And so now I get to bring to the stage a survivor, a champion of calm, if you will, a minister of mindfulness, a high priestess of policy. I am so excited to present to some and introduce to others Maimah Karmo. She is the president and CEO of Tiger Lily Foundation. We are going to have, please come up to the stage, have a seat on the panel. And in true Maimah fashion, we're going to pause for a moment and we're going to have a candid conversation about the truth in diversity in clinical trials. Welcome, Maimah.
Stephanie called me a few years ago to discuss this project and how much it meant to her. And she said to me, I'm metastatic and my life's at stake here. And all of our lives are at stake here. We have to work together. And I really want to honor you, Stephanie, and what you've created here. My heart is so full watching this room of badass Black women doing some epic shit, okay? Yeah. I love it. So thank you, Queen. Thank you. Thank you. So I'm not gonna watch my mouth, I never do. You all know me, so it is what it is. But I wanna create a moment for us to just close our eyes before we start, and just to breathe. I wanna honor the light in this room. I wanna honor the love in this room. I wanna honor the living legacy that you're all creating. I want you to put your hands to your heart and feel your heartbeats. Many women in this room are patients whose lives are at stake, yet you spend every day of your lives working to create a safe space for others, a space of healing, a space of hope, a space of light, a space of love, and a space of legacy. I want to tell you that the light in me honors the light in you. The love in me honors the love in you. My sisters, you all inspire me. You go into the fire every day to help rescue others who are coming behind you. For that, I am grateful. You're changing lives forever. Thank you so much. I want to also honor Dr. Lori Wilson, who was here last year. She was my mentor and my hero and became my friends to all of us. And she always said, while we speak about the importance of Black women and health equity, we must start to speak a new reality, right? You know, in the beginning there was a word, and the word was God. What we speak is what manifests. So, without further ado, I will begin. Dr. Mo will ask, and I'll respond.
I will. So, Maimah, let's talk about this. Where do you think the true challenge lies when it comes to solutions for health equity? Where's the challenge?
So I think that for me, the important thing is we have to move from admiring the problem in each other and how smart we are to getting shit done. Mm-hmm. I think that we spend an inordinate amount of money and time writing about health equity, doing landscape assessments, talking about the problem. Mm-hmm. Black women are dying. Black women don't adhere. Black women don't listen. Black women don't pay attention. Black women are health illiterate. We're not health illiterate. We survive insurmountable odds within this lifetime to be where we are. I think that we hear that we don't, understand. We are afraid of trials. The comorbidities that exist, all those things they're problematic. But how do we look at this girl here and what she needs? She's a young woman who looks like us. And cancer trials are about relationships. They're about authenticity, heart-centeredness. They're about reliability and partner investments. We have to have patients embedded throughout the entire clinical trial process, not when you start and want our opinion or our faces. We can't be a black face. We have to build trusted, educated advocates who are embedded in the community, partner with CBOs and FBOs. We have to engage patients throughout the entire clinical trial process and provide ways for them to have funding to grow their organizations and their nonprofits and to sustain the trial sites where they live, work, play, and pray. We have to ensure that providers understand the importance of equity and their own biases And also, we have to hear what our patients are living with. At the end of the day, we're living with a lot of trauma as Black women. We don't trust because of racism, and that's inherent. It's happened in the past, and it's happening now. We have to address the elephant in the room. Equity is lack of equity is because of racism in healthcare, and we can't be ashamed or afraid to address the uncomfortable conversations.
Wow. You talk a lot about multi-stakeholder approach and accountability. Can you share more about what you mean?
Yes, next slide, please. So what's been, the next one, yes, this one. Okay, so it's important to let Black patients lead. I mean, look at what's the power that's in this room right now. Because Black women are speaking. Black women have been heard. You have to let us lead and work together with us. The patient's also the customer. When you look at, Amazon and Uber and all of the things that we do, look at Nordstrom's. The customer comes first. So we're consuming healthcare, we're consuming information. How do we even get targeted by information that's written for us and written by us, and that's showing faces like ours? When you look at the internet, Instagram, for example, all I get is waist trainers, wig, weave, you see
Talk
that.
about it.
We don't get targeted with the right information. We have to reach people where they are with healthcare consumer information that can save our lives.
Wow.
I don't want to buy a Louis Vuitton purse. I want to buy an experience as a customer of healthcare that can save my and your lives.
Wow.
Thank you.
So is that what you mean when you say put the soul back into the science? You spoke last year at SABCS and you talked about putting the soul back into science. Is that what you meant?
I think we talk about, operationalizing. We discuss investments, we discuss R&D. We never discuss what really matters, the heart of the patient. When a trial stops working, you know what happens? Somebody's heart stops beating. Why don't we discuss the heart of what matters? It's the patient that should come first. So what we've done is engage patients with our partners through the entire clinical trial journey. This graphic is kind of jacked up right now, but what it's meant to show is that we challenge our sponsors to sign our inclusion pledge, which many of you signed. And we're engaging with patients who are our angel advocates. It cannot just be myself, Reverend Tammy, Ricky, Jasmine, Marissa, whoever. It has to be women in the community that are force multiplied through our angel program. So there are 10,000 of us that exist to share our heartfelt experiences where we live, work, play, and pray. We're not just one kind of Black woman, we're different. We're Latina and Black. We're, Indian and Black. We live in different communities, different challenges. So how do you bring diversity, not just of color, but of ideation, experience, trauma, challenges, of faith, of your personal experience. So we're engaging with sponsors to help patients through all those different spaces. And it's been really powerful. We've trained a couple hundred women this year who are Black patients in communities that have the highest breast cancer death rate. And many of our partners have worked with them to hear things they would never heard before because they didn't ask us. They didn't show up for us. We were not included. Now we are. We're at these tables. We built our own damn tables. Okay?
Wow, very much so.
Can we go to the next slide? I wanted to talk more about. So what we did was, how do we not just discuss the problem, but dismantle barriers by driving transparency, authentic relationships, that soul we talked about, into the science, and create best practices that can really be duplicated over time. So who do you go to first? The people. Whenever you get diagnosed, you go to Google first, and you find people that look like you. So we went to the communities that were highly underserved, and we trained Black women on how to understand cancer, their experiences, but how to share that with industry and other collaborators. How do you capacity build? When I first began Tiger Lily, I had no money. I got diagnosed, my husband left, became a single parent after surgery, right after surgery. I had no money, and I had to understand cancer overnight. So I wasn't health illiterate, I just didn't know about cancer care. But also, no one told me how to build a nonprofit. Who tells you how to build a nonprofit? Nobody does. So we have to capacity build, engage multiple stakeholders, and put in place policy that can create practice change across the states and federal level.
Wow, I love that. So talk to me about what that nirvana looks like, right? Where is the nirvana of clinical trials, and what does it look like?
For me, when I close my eyes, I want to see that clinical trials are about care options, not this thing that's far removed, that's scary and daunting. You know, whether it's your allergies or having a headache, you know, you take medications that have gone through trials. So how do we ensure that women are educated about their power? So right now, people are afraid of trials. But Black women are strong, and we have a lot of power. How do you turn that fear on its head into fearlessness to know that being in a trial can change your life or someone's life that you love, or who may never meet you? That's how you create the nirvana in healthcare. One more slide backwards. No, one more. So we are doing work in policy in healthcare, which is really powerful. Go back one more. We got to reverse back.
Sure.
We engage patients of color across the country, which we're training. We work with healthcare centers.
Yep.
We send out barrier toolkits. We are building capacity in 20 cities across the country that have a high death rate for Black and brown women. We have listening sessions to hear patients' voices who are Black and brown. We build around what their needs are. We're engaging in healthcare systems. The EMRs that we use now are pretty much, they spit out data to the patient. How can the EMR or EHR be a more user-friendly, patient-centric educational tool? So we build a map that shows anybody who's touching the patient's lifestyle or lifespan, and we've even got all those partners into our inclusion pledge, working with us to create systemic change that would then become policy and turn into practice across the country.
Wow.
At our state levels and in the community.
That's incredible. So at every level.
We made a map of who's touching the patient at every level. From the nurse, we're partnering with AONN, we're partnering with healthcare provider organizations, we're partnering with the NCI centers, we're engaging with the FDA and CDC. Just name it, we've done it. And my background is working before getting cancer. I was a CEO of healthcare in my life, and I worked with companies like IBM and the government contractors. So I learned early on in my job how to look at data and practice and turn it into policy. So I said, who are the end users? What does the customer journey look like? The patient who's the customer, and who's touching that? Even their moms, your mom. You learn health in your home. How do you have more Black moms telling their daughters to touch their breasts and know what they feel and look like? You look on social media, you see people's boobs everywhere. But when you tell a girl to touch her boobs, it's a problem. Kids learn sex ed about babies in high school. What about the importance of your breasts as a way to, ensure you have equity and access to life? And so we're destigmatizing, healthcare. I want to see women thinking about healthcare like you think about buying a purse or a pair of shoes. If you don't consume the right kind of healthcare, you can and you will die. Healthcare is self-care. I know we're at a point in our lives where after the murder of George Floyd, as you said, the whole world stopped and listened. We cannot make this just a moment. It has to be a moment that's embedded into all we do in healthcare. Before the murder of George Floyd, how many Black women had breast cancer organizations? How many were getting funded at the level they're getting funded now? How many were getting support? How many had a day job? I had 8 jobs, plus single parenting a child with chronic health issues. And I worked 80 hours at my job, and the rest I was working on Tiger Lily. We can't, at the risk of sounding more, but we can't die doing this work. And we can't die because you all get tired of hearing about what we lived through. We've been silenced for how many thousands of years? And now Black women are speaking. We have to have these conversations all the time. The investments y'all making have to happen all the time. We can't just be called in for a campaign to use our faces. We have to be a part of that heart-centric design when you're creating clinical trials in our communities, in the grocery stores, at the CVS's, in our homes. And so again, last but not least, it has to be, again, not a moment, but a movement, one that's based on heart, one that's based on soul, and one that is based on respect and love for our humanity as Black and brown people. Thank you.
Thank you.